Welcome to USMLE World, where we ask, answer, and explain USMLE questions. Today, we're diving into Step 2, Obstetric and Gynecology, Female Reproductive System and Breast. Let's get started with question number 1. For the following case, which of the following risk factors contributed the most to the development of this patient's cervical abnormalities? A. Early menarche. B. Family history of endometrial cancer. C. History of plantar warts. D. Lack of barrier contraception use. E. Nulliparity. F. Practice of douching. The case scenario is: a 35-year-old nulliparous woman is diagnosed with cervical intraepithelial neoplasia grade 3. The patient has been sexually active for 15 years and has had 3 lifetime partners. She has been monogamous with her current partner for several months and has a progestin-releasing intrauterine device for contraception. The patient has never used condoms, and she douches regularly. Menarche occurred at age 9, and menses recur every 28 days and last 3 days. The patient had a plantar wart a few years ago which resolved on its own, but otherwise has no chronic medical conditions. Her mother was diagnosed with endometrial cancer at age 42. The question is: which of the following risk factors contributed the most to the development of this patient's cervical abnormalities? Your options are: A. Early menarche. B. Family history of endometrial cancer. C. History of plantar warts. D. Lack of barrier contraception use. E. Nulliparity. F. Practice of douching. You have 15 seconds to type your answer in the comment box. Congratulations if your answer is D, which is lack of barrier contraception use. This question is designed with the focus to assess your ability to conduct a history and physical exam. Cervical intraepithelial neoplasia represents a spectrum of dysplastic changes that can lead to cervical cancer. Cervical intraepithelial neoplasia and cervical cancer are strongly related to human papillomavirus infection, which directly promotes epithelial cell dysplasia via integration and expression of viral oncogenes. Risk factors for cervical intraepithelial neoplasia or cervical cancer include increased exposure to HPV and impaired immunity, which both increase the likelihood of persistent HPV infection and ongoing cervical dysplasia. Increased HPV exposure: most HPV infections are acquired by skin-to-skin contact. But type 16 and 18, which are responsible for most cases of cervical intraepithelial neoplasia or cancer, are usually sexually transmitted. Therefore, patients with an early onset of sexual activity, multiple or high-risk sexual partners, and lack of barrier contraceptive, or condom, use are more likely to be exposed to oncogenic HPV types. Immunosuppression: in patients with an intact immune system, most HPV infections are transient. However, patients with impaired cellular immunity, for example, HIV co-infection, tobacco use, are more likely to have persistent HPV infection. The correct and consistent use of condoms reduces contact during sexual activity and lowers the likelihood of HPV infection via sexual transmission. Vaccination also decreases the risk for persistent HPV infection, and therefore, cervical intraepithelial neoplasia and cervical cancer. If you choose any option other than D, you are wrong. Let's briefly discuss the other options. A and E. Early menarche and nulliparity. Early menarche and nulliparity increase the risk for endometrial, not cervical cancer. These factors are associated with increased lifetime estrogen exposure, which stimulates endometrial proliferation. B. Family history of endometrial cancer. Family history is a risk factor for endometrial cancer, example, Lynch syndrome, but not for cervical cancer, which is usually due to persistent HPV infection. C. History of plantar warts. Plantar warts, verruca vulgaris, are common in children and young adults. However, they are most often caused by infection with HPV types 1 to 4, which are not associated with cervical dysplasia or invasive cervical cancer. F. Practice of douching. Research on douching and HPV infection rates demonstrates mixed results. That is, douching-induced epithelial injury may increase HPV transmission, whereas post-coital douching may decrease transmission. In general, douching is not a significant risk factor for persistent HPV infection. Your take-home message from this question is that human papillomavirus infections, particularly type 16 and 18, are the primary cause of cervical dysplasia and cancer. The risk is higher in patients with increased HPV exposure, example, multiple sexual partners, lack of barrier contraception use, or impaired immunity, example, HIV, due to persistent HPV infection. Did you get the answer? Proceed to the next question by clicking above only if you've got the answer right. However, should you fail to answer correctly, it is imperative that you watch this episode again. Remember, understanding is key to progress. Unlock the secret to acing your medical exams, especially the USMLE, with our top-notch resources. Ensure you and your friends are well prepared by hitting that like button, sharing this wealth of knowledge, and subscribing to our channel. Remember, your success is just a click away.